Bloating is one of the commonest reasons why people will come to see a gastroenterologist. If I have 10 patients in my office, at least 7 of them will be bloated. And so let's just make this really easy. The last patient I had who was bloated, usually a woman. It doesn't mean that men don't get bloated, but women usually will be, from my experience, will have symptoms consistent with bloating. Hey there, I'm Dr. Ngozi Okoro, but you can call me Dr. O. I'm a board-certified gastroenterologist, and on this channel, I will help you understand your gut and what it's trying to tell you. Whether you're feeling bloated, backed up, or just plain confused by all the health advice out there, I will break it down in a way that makes sense and actually helps you. Every single week, I will be sharing practical tips, research-based insights, and real talk to help you reconnect with your body, trust your instincts, and feel good from the inside on out. It's possible. And so if you're ready to reset your gut and reclaim your clarity, make sure to subscribe and hit that bell. Let's get right into it. And so this patient comes in and she says to me, Dr. Okoro, I am just always bloated, and it's worse when I eat or drink anything. In fact, I can't eat as much as I used to because I'm really bloated. You know the first question I ask? Because the commonest cause of bloating is constipation. The first question I ask is, how often are you having a bowel movement? And my patient said to me, well, I have a bowel movement every day. I said, okay, well, how do you feel after you have a bowel movement? Do you feel like all the stool came out and you're well evacuated? And that's usually when my patient will pause and say, I think so. You see, that pause tells me a lot of things. It tells me that she may not be as well evacuated as she thought. And so if I have any follow-up questions, I ask them. But you know what I always do in situations like that? I get a simple x-ray. You know what it showed in this patient? It said her colon was packed with stool. From the cecum is the right end of the colon, to the rectum, that's the left end of the colon, packed with stool. And so I call my patient and I say, you know what? There is a lot of stool in your colon. Bar none, all my patients are always shocked when I tell them this. How can your colon be full of stool when you're having a bowel movement every day? How is this possible? Here's what I usually say. I say, let me give you an example. You make 10 units of stool every day based on what you eat. You have a bowel movement, you release 5 units. Where's the other 5 units? It's in your colon. It just sits there. The next day, you make another 10 units, right? So now we're at 15 units of stool in your colon. You release another 5 units, you're left with 10 units in your colon. The next day, you make another 10 units, you release 5, we're at 15 units in the colon. Let's say this happens over 5 days. Guess what? Now we're at 50 units of stool in the colon. You know what your colon's going to do? It's going to just keep getting bigger. We call this distension. So your colon gets bigger, and guess what? You start to feel there's something in there. Why am I bloated? I'm having bowel movements every day. I need to go see my doctor. You see your doctor says, are you having bowel movements every day? You say yes. She says, are you feeling well evacuated? You say, absolutely. She gets an x-ray, colon's full of stool. That's exactly how it happens. You know what the next question usually is? Well, if I'm having a bowel movement every day and I'm doing all these things and I'm constipated, do I have a blockage? No. You usually don't have a blockage, stools coming out. Your body is just not getting what it needs to evacuate completely. What does your body need to evacuate completely? 3 main things. Water, fiber, exercise. How much water? 90 ounces. What's 90 ounces of water? 6 small bottles. How much fiber? 30 grams. Fiber-rich foods, fruits, vegetables, potatoes, legumes. How much fiber is in an apple? 3 grams. Most single serving of fruits will have about 3 grams of fiber. How much exercise? 5 days a week, 30 minutes. If you're doing these things 70% of people will not be constipated anymore, or they'll be less constipated. It's always important to keep up with your doctor's visits. You should see your primary care physician once a year, at least. If you are over the age of 45, you should have had a colonoscopy, which means you probably have a gastroenterologist. If you have concerns, questions about constipation, bloating, gas, how much hydration, it's always important to discuss with your doctor. If you can't get access to your doctor as soon as you'd like, just shoot me a message, ask me a question. I'm happy to go into detail, explain what you need, and tell you when a doctor's visit is actually more urgent than you think it is. If this is making sense so far, please go ahead and give this video a quick like and drop a comment if this sounds like you. I read every single one. And if you're learning something new, make sure you subscribe so that you never miss a chance to feel better and think clearer. Thank you so much for watching. If this has helped you understand your gut even a little better, please go ahead and share it with someone else who needs it too. And remember, your gut is more than just digestion. It's your second brain. And when it's off, everything feels off. You know this is true. So take care of it, trust it, and I'll see you in the very next video. Don't forget to subscribe and hit the bell so you don't miss what's next. Be well.